Presentation on information collection from the applicant about making technical file for CE marking process. Welcome to a brief presentation on the basic information needed for your technical file preparation activity for CE marking process. I will explain you in detail about giving us an information in the Excel file. Please note that the technical file which we prepare for you, it will be in the draft stage. It is your responsibility to finalize the technical file. Prior to that, if you can submit us very clear and accurate information, we can be able to make your technical file in such a way that your involvement in fine-tuning or completing the technical file will be as less as possible. Please note that before sending the Excel file to us, please take necessary approvals from the top management or authorized people in your organization who are authorized to approve the final technical file. When we receive information from you, we come back to you. In case of any incomplete data, we focus on the information which is submitted by you, because you are product experts, and not we. The purpose of making this video is to make the process super simple, and, in some cases, if you want to understand the input information details again and again, you can repeat the video many times. So, carefully watch the video, and still if something is not clear to you, please write us by email or immediately call to our technical team, who will be happily helping you for completion of this task. In the first column, we need the product names. Please write one name in one cell only. Please do not write many products in one cell. So, if there are 5 products, you can utilize 5 rows, like number 2, number 3, up to number 6. I request you to take care of spellings, capital, and small letters, or words, numbers in the numerical, or world etc. in the product name. Because the product names, which you will be giving in this Excel sheet, will appear on all the documentation, which will be submitted to you by us. If you are getting a complete product from any supplier, which is considered as the OEM supplier, please write the name of the supplier, so that we can make an agreement with the supplier for you, which can be part of the technical file. Please note that product design is the responsibility of the customer, or you, and not the responsibility of the supplier. When you get any products designed by somebody else, this will be considered as an outsourced process. Article numbers are nothing but the model number of the product, and different model numbers may be because of some different features, or dimensions, or performance of different products. Sometimes same models, with all the features, and same performances, are considered as different models, because of the customer requirements. Definition of the intended use is the responsibility of the applicant, or manufacturer. The intended use should be very clearly defined, with details of where the product should be used and where it should not be used. The intended use must not be misleading information, as the directive is selected based on the intended use of the product defined by the manufacturer. The designation of the person who is responsible to approve the technical file must be technically competent function. The technical competency of the approval authority must be justifiable. It can be a member of top management. It must be a designation of the person who is responsible to prepare a technical file. The person who is responsible to prepare a technical file must be technically competent for making the technical file of the product under scope of certification. The technical competency can be justified with the help of basic education, knowledge, skill and experience. The type of medical device can be written based on the intended use of the product. Like if it is intended to be used for therapeutic application, diagnostic applications, active device, implantable device, a device which is used in the laboratory, etc. If the part of the product comes in body contact with the patient, please identify the applied part which comes in body contact and the nature of contact, like contact with intact skin, tissue, bones, etc. It will help to define the biocompatibility requirements of the medical device or the applied parts. The duration can be in hours, days, months, and years. It is again need to be stated by the manufacturer or the applicant. Sometimes, this information must be supported by the stability study. The raw material, which is used to manufacture the product, can be defined clearly in the cell, and sometimes reference of bill of material need to be stated. Critical component list or list of components with high integrity should be very clearly defined. As the design validation phase, if you have gone through some publicly available literature to prove the compliance of the product to the market requirements and safety requirements, this also include the incidence of the similar product in the market. Literature citation is the responsibility of the manufacturer or applicant. During citation, the applicant must identify different literatures and then need to evaluate the appropriateness of the literature. Classification of the medical device. Based on the Annex 9 of Medical Device Directive, it is required that the intended use of the product must be very clearly understood, and the classification must be verified with respect to the intended use, which is defined by the applicant or manufacturer. When you go to Annex 9 of Medical Device Directive, you will find different rules. We have to very clearly identify that the product fall in the respective rule, and the classification which is identified must be in line with the product and its intended use. Either complete product or part of the product can be sterile if the product or any part of the product is sterile or non-sterile. That should be very clearly defined. If any part of the product is sterile, please mention about the component and its sterility status. If the article numbers are derived with some logic, please clearly define the logic which is used to derive the article numbers. Global Medical Device Nomenclature is a paid service. If you already have taken membership of it and have a GMDN code, please mention it here.